Hello students. Today we will discuss about one of a congenital or genetic abnormality in the child, which is known as Down syndrome, and it is also known as trisomy 21. So let's see what is it. Down syndrome, also called as trisomy 21, is a genetic condition that causes delay in physical and intellectual development. So basically it is a genetic condition. Normally what happens, the human chromosome is 46 in number, that means 23 pairs, but in Down syndrome there is a additional addition of a chromosome. So the child who is suffering from Down syndrome will be having 47 numbers of chromosome. So it is also known as trisomy 21, and when the child will have an additional number of chromosome, it will cause developmental delay in both physical and intellectual aspect. There is extra genetic material from chromosome 21, so individuals with Down syndrome have 47 chromosome in total instead of the usual 46 numbers. Coming to the etiology and pathophysiology, Down syndrome is usually caused by an error in cell division called non-disjunction. So I guess you have already studied about meiosis in cell division in our human body. So this results from error in cell division. So during meiosis, one pair does not divide and the whole pair goes to one daughter cell. So in the resulting cells, one will have 24 chromosomes and the other will have 22. So during cell division, that means during the meiosis phase, one pair of chromosome, usually it divides into two daughter cells, but here what happens in Down syndrome, one pair does not divide and a whole pair, it will go to one daughter cell. So because of that, there will be 24 number of chromosome in one cell and the other daughter cell will contain 22 number of chromosome. So if a sperm or egg with an abnormal of chromosome merges with a normal mate, the resulting fertilized egg will have an abnormal number of chromosomes. So that is the fate of Down syndrome. In trisomy 21, one cell has 21st chromosome instead of one. So the resulting fertilized egg has 21st number of chromosomes. That means in the 21 number of chromosome there will be a additional chromosome, so which leads to Down syndrome, and it happens because of the error in the cell division during the meiosis, where the cell does not divide into two separate daughter cells and it will the whole cell will form another daughter cell. So during fertilization it will cause a problem in the chromosomes. There will be an addition of a chromosome in the 21st number of chromosome of a human body. Coming to the risk factors of Down syndrome, who can develop Down syndrome? Women who are 25 years or older are at the greatest risk for giving birth to an infant with Down syndrome. So the woman who becomes pregnant in 35 years or more than 35 years, those women are at greater risk. So if the woman is 35 years old, there will be a one Down syndrome baby out of 400 live births, and if the woman is more than 40 years old, then there will be one Down syndrome baby out of 110 live births. So according to CDC, Center of Disease Control and Prevention Board, younger mothers, that is less than 35 years, who smoke, use oral contraceptives and have a meiotic 2 error are at an increased risk as well. So if the mothers are not more than 35 years, but if they are younger but they usually smoke and who used to take oral contraceptives for maintaining contraception, they will have a Down syndrome baby. Despite many years of research, advanced maternal age has been the only one factor that is well established with Down syndrome. The clinical manifestations of Down syndrome are microcephaly. The head will appear very small in size. The characteristic features of Down syndrome is a flat face with upward slant to the eye, short and wide neck, small low set ears, flat nasal bridge, and a protruding tongue. By looking itself, you can make it out that the child is having a Down syndrome. Bluish field spots that means tiny white spots on the iris of the eye, short broad hands and feet with a single crease on the palm of their hands. Usually we used to have a multiple crease in our palm, but the Down syndrome baby will have only a single crease on the palm of their hands. Small pinky fingers that sometimes curve towards the thumb, excessive space between toe and the second toe, and muscle hypotonia. The muscle will be hypotonic. What are the complications of Down syndrome? According to the NICHD, that means National Institute of Child Health and Human Development, 95% of individuals with Down syndrome will have mild to moderate mental retardation. The IQ will be sub-average level, delayed language, social and motor development. There will be growth retardation. There is a 50% chance of congenital heart disease, especially atrial or ventricular septal defect. There will be respiratory infections like pneumonia and vision problems like cataract. So mainly the complication is delayed development, maybe in cognitive or physical aspect. There will be less than 60% hearing loss, gastrointestinal blockage or problems like esophageal atresia. There will be constriction in the esophagus, duodenal atresia, constriction of the duodenum, and celiac disease. This is one type of malabsorption disorder. There will be thyroid dysfunctions, sleep apnea, increased risk for dementia in the later age of life, and higher risk for acute lymphocytic leukemia. Diagnostic tests are mainly pregnant women will be offered screening with the option for invasive diagnostic testing for Down syndrome regardless of age. So we have already discussed in the prenatal diagnosis that there are some invasive and there are some non-invasive methods. So invasive methods can be done for the to rule out if the mother is having a Down syndrome baby or not. Invasive methods like amniocentesis, chorionic villus sampling can be done. Chorionic villus sampling, that means sample of placenta taken either through the cervix or through a needle inserted through the abdomen, and test can be performed between 8 and 12 weeks of pregnancy. Another invasive method to rule out whether the mother is having Down syndrome baby or not, that is amniocentesis, that is removal of a small amount of amniotic fluid through a needle inserted in the abdomen. Cells are analyzed for the presence of chromosomal abnormalities, and this test is performed between 12 and 12 weeks of pregnancy. Another invasive procedure is percutaneous umbilical blood sampling or codosynthesis. Here the physician uses a needle to retrieve a small sample of blood from the umbilical cord, and it is usually performed after 20 weeks. That blood and cells will be analyzed for the presence of chromosomal abnormality. After the baby is born, if the Down syndrome is suspected, a karyotype means examination of the chromosomes, blood or tissue samples stained to show chromosomes grouped by size and shape can be performed to confirm the diagnosis. So before birth, we can perform some sort of prenatal diagnostic test like percutaneous umbilical blood sampling, amniocentesis, and chorionic villus sampling. But when the baby is born, then if the Down syndrome is suspected, we can do a karyotyping or inspection of the chromosomes. So coming to the treatment part, Down syndrome is not a condition that can be cured. Treatment is directed at addressing the individual concerns of a particular individual. For example, if the child is suffering from atrial septal defect or ventricular septal defect, then the child will require surgery. If the child will suffer from any type of gastrointestinal atresia like esophageal atresia or duodenal atresia, so that specific condition only it may need treatment. Timely surgeries for cardiac and GI anomalies are necessary to prevent serious complications. Because the risk of vision problems, hearing loss and infection is increased, screening and treatment may be necessary. So these are some nursing diagnosis and interventions. You can just go through it. Coming to the prevention and education part, there no prevention for Down syndrome as it is a genetic abnormality, but yes, we can advise the mothers who are less than 35 years of age not to smoke or have any type of teratogenic exposure. But we can also address the couple to conceive before the mother is 35 years of age. Absolutely nothing that anyone can do to prevent a trisomy, and there is nothing that anyone can do to cause a trisomy. So efforts of prevention are aimed at genetic counseling of couples who are preparing to have babies. Yes, absolutely, that is true that we have to give a genetic counseling to the couples who all are planning to have babies, and screening test of alpha fetoprotein to determine the chances. Teach parents the importance of food and fluids to maintain adequate nutrition, and emphasize the need to balance adequate nutrition. Poor feeding can result in obesity later in life. We have to teach the family how to prevent physical complications, like avoid infection by engaging in good hand washing techniques, increase fiber in diet to avoid constipation, encourage physical activity, and advise parents to seek regular checkup for their child. And if the child is suffering from cognitive developmental delay or delayed speech development, the parents should be counseled to take the child to a speech therapist or a special educator so that they can train the child. Thank you.